Hi everyone, I'm Rachel. This is the change management project for Group 1. Our group members include myself, Jessica, Edward, Alicia, and Kimberly. Our group decided to focus on the communication challenges people face daily in the healthcare field. We incorporated Kotter's 8 Steps in the Heart of Change in our presentation by focusing on the urgency, building a guiding team, getting the vision right, communicating for buy-in, empowering action, creating short-term wins, not letting up, and making change stick. Issues arise frequently from communication challenges between patients and healthcare providers. Some of the struggles medical personnel face daily are speaking different languages, lack of in-house interpreters due to high prices, and lack of staff who speak multiple languages in order to interpret or speak to the patients. The high ratio of patients versus healthcare workers puts a strain on quality and effective communication between the patients and the healthcare providers with full schedules. Statistics show that 1 in 5 U.S. residents don't speak English at home, meaning there is an increased sense of urgency to provide proper communication between patients and their healthcare providers. In Seattle alone, 20.5% of residents are native speakers of a non-English language. 3.95% of the overall population in Seattle consists of native Spanish speakers, and 3.65% speak Chinese. In order for everyone to have the best quality of care, barriers need to be broken down, and there needs to be a proper tool to communicate to patients. Imagining going to a place like urgent care and having nobody speak the same language as you is terrifying and challenging at the same time. Feeling as comfortable as possible and understanding the providers while at a healthcare facility is crucial for the patients.
Hi, I'm doing step 4, which is communicating for buy-in. The goal is basically to make this service public knowledge and to spread the awareness of in-demand interpreting for the healthcare setting. I think empowering those with the greatest need for this service would be the best way of approaching the idea of in-demand interpreting. Such as nurses and providers, because they're the ones that would talk to the patients on a more personal level and about medical issues that they're having. And there's a couple of clients that I spoke with that use in-demand interpreting. One is Beth. She's the patient services manager at Seattle Reproductive Medicine. She works with in-demand interpreting. She said that they utilize their interpretation services as well as other businesses like Polylang, which is located in Bellevue. They also use some other businesses, but we didn't get too far into that, unfortunately. And also Kathleen Toe, she's the systems manager for Swedish Medical Center. She's utilized in-demand interpreting for over 9 years. They have over 300 medical devices that they use to access this service for their clients, for their patients. And that's actually in-demand's primary method of communication, which is through video, which is what we're doing now. I'm also doing step 5, which is empowering action. I do believe that the way to empower action is to continually inform people about this service and let everyone know that it's out there. And if we keep driving that point home, whenever an occasion arises when translation is needed for medical related issues, I think it's good to just keep reminding people that the service is out there and to let them know about the quality that they are offering to their patients. And the ease of use is a good point to drive home as well, is letting people know that it's out there and it's easy to use and it's convenient and it's probably the most cost-effective method doing things over remote access with video and such. So I do think that this is a good project. I think that it's convenient, it's straightforward, and it's very cost effective as well. The clients that use them have said that it's convenient, easy, and effective because they have several languages that they offer that some of the other services that they use, other interpreters, they don't have as many languages to offer, the wide variety of languages. So I think as long as we just keep bringing it up as an option, it's kind of a service that sells itself.
Hi, I'm Jessica Kirby, and I'm going to discuss John Carter's Steps 6 and 7 from the Heart of Change and how a local hospital used those steps to implement interpreting services from in-demand interpreters. Celebrating the little wins helps to bring the team together and keep the momentum of the team going. It helps to eliminate the questions and empowers the employees. With celebrating short-term wins, employees will increase their faith in the team and the ability to reach the overall goal. Since we did not have a clinic that we could actually implement the change of adding interpreting services from in-demand, I researched a local hospital with an urgent care setting that has. At Central Washington Hospital and in the emergency room, having an interpreter was limited to one staff member on hand during the day. This made making a hospital run smooth very difficult, since they did not have an interpreter that they could reach at all hours of the day and for multiple patients. In the Wenatchee area, the minority of the population is roughly 25% and growing. Having one Spanish interpreter available, patients' wait times averaged around 45 minutes before they were able to interact with hospital staff. After installing 45 video remote interpreting stations within their emergency room, the short-term wins started to show. They started with more patients walking in the door. The wait time at check-in was cut down, with there now being a computer right at the entrance of the hospital where patients could pull up an interpreter from the start to help their check-in process. The nurses also had computers on wheels where they could access an interpreter and take the interpreter with them room to room, patient to patient, making having an interpreter readily available. A large short-term win was the overall cost cut that comes along with using in-demand interpreting services. The budget, which typically trends around $500,000, was cut down to $225,000, which still included an on-site physical interpreter for during the day. Step 7 is don't let up. After creating short-term wins, you want to make sure that the team does not let up or burn out. After celebrating the little wins, some of the momentum starts to fade, and some might say, "We've done enough," and give up. This is when you need to keep that urgency going and don't let the momentum stop. After celebrating the wins, Central Hospital did this by pushing on, and they kept utilizing the computer interpreting stations in the hospital. They were able to hit their main goals, and they were able to increase the overall patient satisfaction. With cutting down wait times for patients, they were experiencing an overall smoother medical experience. With using in-demand interpreting services, the language barrier was no longer an issue for non-English speaking patients, and they could easily communicate with their medical professionals and communicate their concerns and why they were there. Along with this came a decrease in the margin of error in the hospital. Patients now had an interpreter at the touch of a button in their rooms with them at all times with a wide camera angle, allowing the interpreter to see the hospital staff and the patient and the interaction between them.
Hello, my name is Alicia Trong and I'm going to discuss how to make change stick. According to Kotter's 8-step change model, making change stick can be difficult to achieve, but must be implemented into the organization's culture in order to make it happen. The organization's new leaders, managers, and staff must also support the change, otherwise a lot of effort and resources would be wasted due to the lengthy process it takes to implement a change. You may be wondering what works best in order to make change stick. Not stopping at step 7, it isn't over until changes have roots. Using new employee orientation to compellingly show recruits what the organization really cares about. Using the promotions process to place people who act according to the new norms into influential and visible positions. Telling vivid stories over and over about the new organization, what it does and why it succeeds. Making absolutely sure you have the continuity of behavior and results that help a new culture grow. These tips will help an organization to ensure that their change will stick and carry on in the organization's culture. Urgent care clinics can better serve their patients by offering in-demand medical interpreting services. Due to the nature of urgent care clinics, interpreters are needed at very short notice. In-demand interpreting services can increase the efficiency and effectiveness of the care that is delivered to all their patients. Urgent care clinics all over the Puget Sound can use in-demand medical interpreting services, and it is important for them to follow Kotter's 8-step model of change in order for them to implement a change successfully. There are benefits of implementing a change in the interpreting services offered at an urgent care clinic. These benefits include an increase in the care delivered to all patients, no matter what language they speak, an increase of overall patient satisfaction, and an increase in the overall population health. By applying Cotter's 8-step change model, an urgent care clinic can successfully change for the better when it comes to offering the best care and satisfaction to every patient in any language.
All steps with John Carter's The Heart of Change, 8 Steps to Success, can be accompanied with complications. As a team, the only complication we encountered was not being able to actually implement the change into a clinic. Instead, we had to do our research and contact local hospitals, clinics, and urgent cares in the area that have implemented the change of adding in-demand interpreting services to their clinic and see how the process worked for them. Personalities played a large part in executing a change in any setting. Along the way, we always had a driver that took charge with either initiating the conversation and getting the ball rolling or actually telling the team members what needed to be done. There were also some avoiding personalities along with accommodating. Overall, this project ran smoothly, and had we been able to actually implement the change into a clinic, I do not believe that our personalities would have been an issue during this.